Hello, everyone. Don Garman here from Mirador Capital Partners. Here again on a after a great Fed announcement, holding rates once again at unchanged, not lowering, but not increasing. But that's not why I'm coming to you today. What I wanted to do is introduce a bit of a new concept. We did the intro yesterday on the video that will be attached to this, but it didn't catch the recording properly, and I wanted to introduce the idea. So obviously, we've gotten in the cycle of monthly market-oriented videos, and what we've noticed is that inbound questions from clients attending to things that are happening in their life have started to cluster around certain topics or themes. And generally, as we've done, we would be investigating answers to those questions. However, at the age that some of us are or are approaching, these different subjects, Social Security, Medicare, long-term care, life insurance in general, broader financial planning concepts are sort of accumulating. And so we're going to be doing a series of what we're calling webinars, different than the sort of outbound videos that we do on markets, that we will be accessing what we have access to, which is an extraordinary body of experts on a variety of subjects. And we'll be doing this, kind of every few months or so. And then obviously the outcome will be a body of work that if it's useful to you and you want to join live, wonderful. So you certainly will have access to the recordings after. And then if it's easy, you can send them to people who you think might benefit from them, and do it in a very low pressure way. Obviously, we're doing this as a service to you and not necessarily as a marketing angle, if you will, but certainly that may be the unexpected byproduct of it. So the first session, which you're about to see, is on Medicare. The observation that we had was it was a lot more complicated, even as I started to get into it myself. And I'm fairly sophisticated in my understanding of a lot of these things. It was a lot more complicated than I knew. And I assumed it was sort of a set it and forget it system. And it very much is not that. And so what drove this is some of you are starting to earn income again in retirement or anticipating doing that, and have somewhat control of the timing of lump sums and windfalls around some things. And so it's important to understand how this impacts Medicare. And I've seen the impact of some people getting it wrong, and it's unpleasant. So I really just want to raise the topic. And we will be doing this, as I said, periodically to give you access to some of the, and I'm not over dramatizing, leading experts in the industry on various subjects. So I'll leave it there. Hopefully you enjoy the discussion. And if it's useful to you and you can think of anybody else you think it would be useful to, please forward it. And until the March video, which is now just a little bit over a week away, thank you, Jerome Powell, for delivering such a pleasant report today. And obviously the press conference was very well received. So yay for all of us. And on we go to the end of Q1. And I'll talk to you again in a couple of weeks at the beginning of Q2. Okay, thanks. Bye.
All right. Well, thanks for having me, and welcome everyone. I think I'd like to start by just hopefully offering an observation that everyone finds rather logical, which is, congratulations on purchasing Medicare, but you probably did so in complete and total ignorance, because when you got your very first job, they started taking money out of your paycheck for both Social Security and Medicare, not giving you buyer's guides or user's manuals, actually teaching you what it is you were buying. So as you arrive in your early 60s, now suddenly you need to make decisions about both of these programs, and they can be confusing and a little daunting. So my goal here this evening is just to try and make everybody a little more informed consumer about a purchase you've been making your entire working lives. Now, when it comes to Medicare, the first kind of moment of awareness, if you will, that, ooh, I kind of got to get my act together, is probably around when you celebrate your 64th birthday, because it's going to be at that point that every single insurance company on the planet starts to flood your mailbox with information about why you should be buying their form of Medicare. And it can be overwhelming, to say the least. And so what I'd like to do is maybe just give you some guidance on how you sort through all of this information you're getting and ultimately get yourself prepared to make an informed decision about your Medicare election. Let me start by offering up that fundamentally, you need to decide, do you want to consume Medicare a la carte or all in one? Those are kind of your two paths. And you probably need to research both before you can decide which one makes the most sense for you. Now, the a la carte option is often referred to as original Medicare. And then the all-in-one option is referred to as Medicare Advantage. Now, Medicare has done some creative marketing work to help us with this. So they have named the basic parts of Medicare, Part A and Part B. And so everybody gets those, regardless of which path you go, a la carte or all in one. But then your choice is, do you want to wrap A and B? And I'll go into more detail about what A and B are. But essentially, you're either going to wrap A and B with your own prescription drug plan, which they have conveniently named Plan D. And then you can optionally wrap all three of those with a supplemental policy, often referred to as a Medigap policy. And again, along this theme of very creatively naming these things, they've decided to name all those supplemental policies Plan A, Plan B, Plan C, D, E, all the way up to Plan N. And that's not confusing, is it? To have Part A's and Plan A's, that's logical. So that's original Medicare, right? You're going to wrap your A and B with a drug plan and a supplemental policy. And again, I'll go into more detail about all of that here in a second. The alternative is that you wrap A and B with Part C, Medicare Advantage. And that will oftentimes include your prescription drug plan. It'll include some extras that are not part of original Medicare, like dental, vision, hearing, those types of insurance benefits. And so, again, that's big picture. That's your homework assignment. Do you want to go a la carte or do you want to go all in one? So why don't we peel this back a little bit more and talk about each of the individual components. Now, one of the things I'd like to point out is we do have available, and Don, I'm not sure, did we send this to everyone or are we sending this as a follow-up? This guide, I'm sharing my screen right now, hopefully everyone can see it, which summarizes a lot of the key components of what I'm going to go over here and can serve as a great quick reference after the fact.
Yeah, thanks, Rob. I think everybody's got that already. And then we're going to send also some additional, notes and frequently asked questions after.
Excellent. So one thing I'd point out here is at the very beginning of this document, they have a quick summary of what I just mentioned. So you'll see a description of Part A, Part B, and then the three optional elements. So you're either going to bundle D and a Medigap together, or you're going to go with Part C. But let's get back to the definition. So Part A is essentially going to pay for any time that you're spending in the hospital. So think of it as like your room and board for when you're in the hospital. It's not going to cover the expense of any of the doctors who visit you or any of the equipment they use to, make you better. All that stuff is covered under Part B. So pretty much any time you spend with a doctor and any of the stuff they need to make you better, that's going to be Part B. But Part A is essentially your room and board when you're in the hospital. And then you're wrapping both of those with basically better and deeper coverage, right? So you're improving upon what Parts A and Parts B do all by themselves. Now, all of these components can have a premium, meaning a monthly amount of money that you have to pay in order to have them. Now, Part A can be free, So that's essentially the part that you've been buying your entire working career. And that 1.45% that comes out of your paycheck is buying for you. And so if you've got 40 quarters or 10 years worth of payments, then you will not have a premium payment for Part A. You'll get that one for quote unquote free. Part B, however, is going to have a premium. Doesn't matter how long you've worked and how much you paid in, you're going to have a premium for Part B. And we'll talk about how that can be structured and how it scales based upon how much money you make a little bit later. Part C, if you decide to go the all-inclusive route, that can have a premium associated with it. Or if you go the a la carte route, your Part D prescription drug plan will have a premium, as will that supplemental or Medigap policy. So there can be, up to 4 premiums at play here. But for most people, it's up to 3 because you got your Part A already covered with your 40 quarters of work. Now, as I mentioned, your Part A's for the time you're spending in the hospital. You'll notice here on this guide that for the first 60 days that you spend in the hospital, once you've covered that initial deductible, which is about $240, there, you're not paying anything more for room and board in the hospital. If you end up staying more than those 60 days, however, they are going to start charging you a daily rate. Right now, that's $408 a day. And then once you get past 90 days, then you start eating into what are known as your lifetime days. So you have 60 of these kind of extra bonus days that you can spend in the hospital. Now, they're going to charge you $816 to use any of those reserve days. But once they're exhausted, then the whole bill is on you, and they don't get replenished. Like those bonus days are for your entire life. Now, if you're in the hospital and you get discharged and you're out for basically a week or more, if you have to go back in, the clock starts over again. So you don't have to worry about that. And again, if you look at the way medicine's working today, very few people stay in the hospital, longer than 60 days. But it's important that you understand that's how the Part A benefit works. Now, there is also this notion of a skilled nursing facility coverage. I want to be clear that this is not going to pay for a nursing home. If you need to go into a nursing home, that is not Medicare, right? That's going to be a long-term care policy or some other insurance that you've purchased or a self-funding mechanism, but don't look to Medicare to pay for your stay in a nursing home. All right, then when we get to Part B, which is, again, pretty much any time you're spending with a doctor and any of the stuff they need to make you better, that's going to have this premium associated with it, which has a basic premium, which you'll notice here is $174 per person per month. And then if you make more than a certain amount of money, and again, we'll talk about this more in a little bit, you will pay more than that $174 per person per month. Now, there's an annual deductible here for this piece, and there's a copayment, and there's also the reasonable charges, if you will, that Medicare has laid out for anything that you're going to do. So that's why most people that are going to be on a call like this will not just take Part A and Part B and leave it there, right? Because if you do that, you're leaving yourself open to potentially very large bills as a result of that cost-sharing mechanism that they have in Part B and the like. So that's why people will either wrap that with a Part C, so they'll go the all-in-one HMO route. And in that instance, you're also buying a bunch of other benefits in addition to the vision and the dental and all that kind of stuff. You're buying essentially lower potential deductibles, lower co-payments, lower shared expense charges, so acceptable charges to Medicare. Oftentimes, these will step in and pick up those as well. That's also the role of the Medigap policies. So the Medigap policies will also step in and fill in gaps in what Part A and B are covering, hence the name Medigap policies. Now, let me jump now to that part about the premiums and how they can be more if you're making a certain amount of money. So at the very end of this document, there's this section called the high income premium surcharges section. And so for each year, the thresholds that determine what your premium will be usually go up. So you'll notice that for 2024, that lowest premium is $206 per person per month. I'm sorry, the threshold in earnings to have that $174.70 premium per month. So your joint, as a married filing joint couple, if your income is $206,000 or less, and I have to clarify here, when I say income, pretty much think about all income. They're using this term modified adjusted gross income, which is essentially, and we are in tax time, so you might be familiar with this. If you're looking at your 1040, the number at the very bottom of page 1 is your adjusted gross income. And then they make you copy it to the top of page 2 just to rub it in. Then you're going to add some more stuff to it, like your tax exempt interest. And that's how you get to your modified adjusted gross income. So pretty much any money that you earn is going to be included in this amount. And if it's $206,000 or less for a married couple, you're going to be in that lowest premium tier. This is one of the very few government things that's not on a progressive schedule. It's on what's called the cliff schedule. So again, if you're 206 or below, you're at that base premium amount. But if you earn $1 above 206,000, you immediately jump to the next premium tier, which you'll notice is $244.60 per month. So one of the things you want to keep an eye on is ideally you don't want to just barely go over one of these cliffs, because you've now just set yourself up for a 70 to, potentially 100 and some odd dollars per month per person increased Medicare premium. And that's for Part B. You'll notice there's also a premium added for Part D. So just keep that in mind. I'll also want to point out that they're going to be looking at your income from 2 years ago. And that's because that's when Medicare finds out about how much money you make. So think of it this way. The tax return that you're working on right now has a due date of April 15th. But if you're a procrastinator or more complicated, you can put that off till October 15th. And so essentially, IRS isn't really sure how much money you made until you finalize that thing. And so they're able to share essentially the beginning of next year, your 2023 tax return. So at the beginning of 2025, they're gaining visibility to how much money you made in 2023. So that's why it's on a 2-year lag. So keep in mind that if you have a massive capital gain event, you sell a business, have some other liquidity event, 2 years later, you will see a spike potentially then in your Medicare premium. And, a lot of people get surprised by that. And so I want to try and take that surprise away. Now, if that massive spike in income was due to a life-changing event, meaning you retired or something along those lines, there is a form that you can fill out appealing that massive spike in your premium and say, look, that was a one-time thing related to this life-changing event, and it is not reflective of my normal income. I would like to have you reevaluate this premium based upon what my normal income looks like, because that spike was due to this life-changing event, meaning I sold my building when I sold my business when I retired, or that type of stuff. So keep in mind that you can't appeal that spike if it's due to that life-changing event, and they reevaluate your premium every year. So again, this year for 2024, they're looking at your income in 2022, and it rolls forward like that every year. Once you're in Medicare, they will send you a letter in December letting you know what your premium is looking like, what they're planning to charge you for the next year, and that would be your opportunity to then appeal that excessive charge that you don't feel is fair. Now, I mentioned once you're enrolled and once you're in Medicare. So why don't we talk about these enrollment windows? Because that's where I get a lot of questions from people. It's like, all right, when do I need to enroll in this stuff? So the first thing to keep in mind is that your earliest opportunity to do this is what's called your initial enrollment window. And that is a 7-month window that lasts 3 months before your birthday, the month of your birthday, and 3 months after your birthday. That is your initial enrollment window to get into Part A and Part B and Part D, if you're going the original Medicare route. Then you have a little bit of extra time if you're dragging your feet to pick that Medigap policy. But keep in mind, you only have 6 months once you elect your Part D coverage to select your Medigap plan. If you miss that window, if you take Part A and Part B and you do not select your Medigap plan within the first 6 months, bad things happen. And the worst of those is that when you finally do decide to make a decision about your Medigap coverage, you'll be subject to underwriting, and you can be denied coverage because of a pre-existing condition. You could be charged more than they normally would charge you because of that health history. So you do not want to miss that window. If you're going the original Medicare route, you want to make sure you've done your homework and your research and you know what you want to buy prior to that 6-month window closing. All right, so that's your initial enrollment window. That's your initial opportunity to get into Medicare. So why might you skip that initial enrollment window? Well, if you're still working for a company that has more than 20 employees, you do not need to enroll in Medicare at age 65. You can wait until you separate from service. At that point, you will qualify for something called, the very bottom of this list, your special enrollment window. It works exactly like the initial enrollment window in the sense that you have all the same options and all the same pricing. You have that same 6-month period to make your Medigap election. So, and it can be at any time during the year. And that special enrollment begins the day you turn 65, and it ends 8 months after you separate from service and no longer have access then to that plan from a company that had at least 20 employees. So a lot of people hear like, oh, but I was told I need to, get into Medicare before I turn 65, because if I don't, I face all these penalties, which you'll see down here in this box, these penalties for late enrollment. And the biggest one of these is that 10% incremental penalty for every year that you wait to enroll, that you do not have a valid reason for not doing so. So this would be someone at the age of 65 who isn't covered by a work plan where that company has at least 20 employees, but you've decided, you know what, I'm super healthy. I'm going to wait till I turn 70 before I enroll in Medicare. Well, that's 5 years past the deadline. So once you do enroll at age 70, first off, you're going to be enrolling in something called the general enrollment period, right here, January, February, and March. So you got to wait until then. You don't get to do it whenever you want. You have to do it during that 3 months. And your coverage won't be effective until July of that year. And because you waited 5 years, your Part B premiums will now be 50% higher for the rest of your life. For every year that you waited, that you didn't have a viable reason, it's a 10% cumulative penalty. So you do not want to miss the initial enrollment window if you are not working for a company with at least 20 employees and covered by that insurance plan, or miss that special enrollment window, meaning you don't want to wait more than 8 months after you separate from service, because then you're going to be in that situation where you got to wait till January, February, March for the general enrollment window. You will not have as many options and the pricing will not be as attractive. and you will have this permanent penalty in place. Now, one thing people ask me is, well, I've been told that when I turn 65, I should just enroll in Medicare anyway, even if I am covered by my plan at work. And generally speaking, that can be pretty good advice to enroll in Part A. If you recall, we went over Part A here at the beginning. Part A doesn't have a premium as long as you've got your 40 quarters of coverage, right? So it's quote unquote free. So why wouldn't I, take it, even if I've got my work-related coverage? And for most people, you're right. You should enroll in Medicare just in Part A because it gets you into the system. It'll work as a secondary payer. So if you do find yourself in the hospital and your work-related coverage maybe doesn't cover everything, you may find that Medicare will step in and cover some of that. So great idea. My only caution to you is you don't want to do that if you're participating in, and I'm sorry, contributing to a health savings account at work. So you may or may not be aware of, at work, they have most companies have an option where you could participate in something called a high deductible plan. And when you participate in that high deductible plan, they give you the option of making before tax contributions to a health savings account. Now, these health savings accounts are the greatest accounts ever created. The money goes in tax-free, the money grows tax-free, and the money comes out tax-free. So they are awesome. But if you are participating in any part of Medicare, you are no longer allowed to make contributions to those accounts. You can still have the account, you just can't put any more money in it. And so the only reason you wouldn't enroll in Part A of Medicare when you turn 65, even if you're still working at your company, is if you're participating and contributing to that health savings account. Otherwise, if you're not, great idea to enroll in Part A. Just make sure, again, when you're enrolling, you're clarifying that I just want Part A. Because if you enroll in Part B, not only are you paying that monthly premium that you probably don't need because you're paying for your work plan, but you've also now started the clock, that 6-month clock, for having to make your Medigap decision, which again, you probably don't want the Medigap policy if you're consuming your at-work health insurance. So a lot of moving parts there, but the punchline to all of this is, from an enrollment standpoint, is please be aware of these two very important deadlines or enrollment periods: the initial enrollment period, and then this thing called the special enrollment period.
Hey, Rob.
Yes.
I'm going to interrupt with a quick question. It had to do with, what if you were covered by your company granting you Cobra as a separation agreement? Do you have a...
Yeah, great question. So whether you're covered by Cobra or not, which, by the way, it's law that you have to be if you were offered the plan at work, they have to offer you Cobra coverage for 18 months after you separate from service. That in no way changes anything I just said, though. You still only have 8 months after you separate from service to use the special enrollment window. So sure, you could stick with Cobra for 18, but you're going to find that at the end of that 18 months, you've now been out of compliance for 10 months. So now you have to go into the general enrollment period. You've now got a 10% penalty to your premium because you waited about a year before you got in. And you're not going to have as many options. So not a great idea. The other thing I will point out, and a lot of people don't know this, is that a lot of the Cobra plans will only be secondary payers to Medicare after you turn 65. So you might be thinking, oh, I'll wait and do my research. I'll use this 8-month window to make my decision. And then at month 6, you find yourself in the hospital needing some procedure. And suddenly the Cobra people tell you, yeah, we're not going to cover anything because we're secondary payers. You were supposed to have enrolled in Medicare at this point. So please make sure, if you are going to take your time and use that full special enrollment window, make sure that you've talked to the insurance company ahead of time and clarified that when you're under Cobra, they are going to be primary paying, because in many instances, they are not. So that also kind of brings me back to a general theme here about when you turn 64, suddenly all this mail starts showing up in your mailbox. That is your notice that you've got to do your homework. It's time to roll up your sleeves, go back to being in high school and having to write that senior thesis. You got to do the research then, because even if you're still working and you're still going to be under that company paying plan, I have seen and I have talked to a lot of people who had the intention of working to 68, 70, 72. And then the company changed their mind and had a different intention for them. And suddenly they find themselves separated from service, not because they chose, but because the company chose. And now, in addition to all the other stuff you got to sort through because of that, you also got to wade through all this Medicare stuff. So it would be my suggestion that you use that 64th birthday as kind of the starting gun for, all right, I got to get serious about understanding what options I have available to me and which ones make sense for me and my family, so that when you do get to the point where you're separating from service and you've chosen to do it, or somebody's chosen that for you, you're ready, right? You know what you want to do and you can pull that trigger. All right. So why don't we dive in a little bit about how do you go about that research project then? And how do you understand whether or not you want original Medicare versus, the all-encompassing Part C and Medicare Advantage component of Medicare? Well, there's two resources that I would strongly encourage all of you to take advantage of. So the first one is Medicare.gov. Phenomenal website. Now, a decade ago, I would not have said that, but they have spent a lot of time and energy and effort really making this an excellent website. So all of that awesome marketing horsepower they put behind naming stuff, none of those people were responsible for this part of the Medicare project. These were actually competent people who really put together quality stuff that's going to help you make this decision. The first thing I would do is I would click on this getting started with Medicare. It gives you a lot of the stuff I just talked about, walks you through the two paths of a la carte versus all-in-one, goes into more detail about each of the components, Part A, Part B, Part D, et cetera, et cetera. So it's a really good primer for everybody. Strongly encourage you to take advantage of that. They've again laid it out in a very nice and easy to follow way. Would absolutely encourage you to do that. The part you're going to use though for your research is this second tab over called Find Health and Drug Plans. And you're going to click on this link called Find Plans Now. Now, one thing you need to understand about Medicare is what you're offered depends on where you live in retirement. So it's zip code dependent. So the very first thing you need to do, if you haven't created an account, by the way, I would encourage you to create an account because it'll save all of the information you type in so you don't have to type it in again. Very convenient. But, type in your zip code. So all of you are going to benefit from learning about New Jersey's Medicare offerings because that's where I live. So that's my zip code. So I type that in and it gives me an option about what do I want to research. So again, as I mentioned, there's no research for Part A and Part B. They are what they are, right? They're covering your hospital stay and they're covering your doctors. Now you're deciding how do you want to wrap those with additional coverage. And so you can either do that with this Medicare Advantage plan, or you can do it with these drug plan and Medigap policies. So we're going to actually jump down to the Medigap policy one because I want to walk through that Medigap stuff in a little more detail because it can be a little confusing given all the naming conventions. So once you select, all right, I want to look at Medigap policies, you're going to click this Find Plan buttons. And what it's then going to do is it's going to go out and it's going to search its database for all of the Medigap plans that are offered in your zip code. And as I mentioned, they have all these creative names, Plan A, Plan B, Plan C, so on and so forth, right? So you see this long list of all these different plans with a different letter after them. Medicare has mandated what these plans must include. So a Plan G is a Plan G is a Plan G. It doesn't matter who you buy it from. It's going to have the exact same coverage. It's mandated by law what a Plan G covers. And just so you know, Plan G is the current Cadillac of Medigap policies, right? It covers the most stuff. All the other letters are slightly more inferior versions of Plan G, with the exception of Plan F. Plan F used to be the old Cadillac version, but you'll notice here this note, this plan isn't available if you turn 65 on or after January 1st, 2020. So they took the F letter off the table. I guess, you know, they thought it could get confused with a 4-letter word or something like that. So they decided Plan F was no longer a good term to use. So you can't buy that one anymore. Plan G is the new Cadillac letter. So my point is, though, you probably want to look at all the letters to see, you know, what kind of coverage makes the most sense for you. And one thing I'll point out here is you have this option. So they give you a brief summary here in each of these boxes, but they give you this option to click Plan Details, which will now give you much more detail about what a Plan G covers. So it goes into what are the general costs. So what can the premium range? In the state of New Jersey, it can range from as little as $138 a month to $49.44 a month. Quite a range. It also will cover or talk about what kinds of you know, gaps it fills in. So what does it do if you're in the hospital? What does it do about, I love this part, like your first 3 pints of blood are on the house when you have Part G. I didn't know blood was that expensive, but boy, they take care of you with the Cadillac version. Anyway, this is a, you know, a pretty decent.
Sorry, Rob.
Yeah.
Do you have any idea what accounts for the huge difference in those two?
In the premium amounts?
The range, yeah. I mean, that's massive.
So I'm going to go
range.
into that. I'm going to go into
Okay,
that now.
got it. Sorry.
No. It's like we were, you know, we'd practiced this ahead of time. So let's click View Policies, because now you're going to see what leads to these ranges. So these are all the insurance companies in the state of New Jersey, or in my zip code more specifically, because actually it is more zip code dependent. You'll find in some states, if you live in the northern part, you have access to some things, and in the southern others. So it isn't state specific, it's more zip code dependent. But you'll see there is a long list of insurance companies that are providing this coverage. And you'll notice that within each one, so for example, here's Aflac, right? You guys probably have heard of them. They're the one with the duck and Gilbert Gottfried pretending to be the duck's voice. You'll notice that right now they're estimating that for someone in the state of New Jersey, that premium somewhere between $143 and $883. And there's a link here where I can get a more accurate price. So if I click on that, it's going to take me through some profiling questions. And while they can't deny you because of your medical situation, they can ask you how old you are, whether you're male or female, whether you smoke or not. And based upon those things, that will drive whether you're at the lower end or the upper end of this premium, this monthly premium. So what I will tell you is, as you're looking through this whole list, keep in mind that every single one of these policies is giving you the exact same thing. So what you're searching for is price and service. So if you come down here and you see, you know, Joe's Garage, you know, Medicaid or Medigap policy, you know, maybe you don't want Joe's Garage, you know, taking care of you because they might not be around, you know, they might not have people answering the phone if you have a problem. So you probably want to pick a name that has been around for a while, or that you've at least heard of. Do a little due diligence to make sure they're not a fly-by-night operation, and then figure out who's going to charge you a reasonable premium for that particular coverage. So again, you'll see here at the top, you can refine this search a little more if you were to put in your age, your sex, whether or not you smoke. And then you can click update prices and it'll update them based upon that information. And then if you click the get more accurate price, they'll actually go through the profiling process to give you something that's much more tailored to your situation. So that's kind of the way this research capability at Medicare.gov works. Again, you can do this for the Part D prescription plans. You can do this for the Medigap plans. Super helpful, great way to understand what's covered and how much are they going to be and what's available to you on the zip code that you're going to be retiring in. And that's important, right? You might live in a zip code right now, but you're going to be retiring in some other place. You're going to want to do the research for where you're going to live in retirement and consume Medicare, because
Rob, the question has come up, and I think you can see it in the chat. Multiple people on this Zoom have multiple residences. And so obviously, I'm sure, I don't know if it's the 6 month and a day that's going to drive it, but what are the rules?
So essentially, whatever you are determining for tax purposes is your state of residence is what you'll want for your Medigap or your Medicare election. But also keep in mind that if you go Medicare Advantage, you're picking that network. And if that network is only present in one of the places that you have a home, that will be a bad choice for you. Because when you're in the other home, you're not going to have access to that network. And so you're either going to have to get on a plane to go.
So this would be an argument for choosing based on the ones that have a broader range, even though they're maybe more expensive, because you're going to need.
You do one of two things. You would either pick a Medicare Advantage plan that has a network in all the places that you would be in retirement, or you would go Medicare, original Medicare, because that allows you to go to any doctor that accepts Medicare. And quite honestly, that's for a lot of people, that's what it comes down to. The decision of simplicity versus flexibility. So with original Medicare, you have all the flexibility to go to any specialist, any doctor that accepts Medicare. You don't need to work within the network and get referrals and all that kind of junk. But right, you got to piece all these things together, and you got to go get your own dental, your own hearing, your own vision insurance if you want those things, because those aren't part of original Medicare, versus the convenience of it gets all packaged together. So just, to make this a little personal, my folks have been in Medicare now for a little over a decade, and they went the Medicare Advantage route because the doctors that they'd been seeing their whole life were part of the Medicare Advantage network that was offered, and they love those doctors, they love those hospitals, they love the whole network, they love the whole deal. That company had been around forever and had great reviews, and everybody had great things to say about them. So that's why they did it, right? Simplicity as well as reputation and convenience. It met all their needs. I was talking with someone actually just at the end of last year who went the original Medicare, lives in New Jersey, went the original Medicare route because they want the flexibility. They've got some history in their family of some not great medical things happening. And they want the flexibility that if they need to go to Johns Hopkins, they need to go to Sloan Kettering, they need to go to the Mayo Clinic, whatever it is, they want the flexibility to go wherever they need to go and not be hamstrung by the plan that they have. So food for thought on all of that. All right, so we've covered the parts, Part A, B, D, C, and the Medigap policies, right? So everybody gets A and B, and then you just have to decide how to wrap them. Then we've talked about the plans, plan A, B, C, D, all the way up till N. So if you go the original Medicare route, you got to pick, which Medigap policy you want. We've talked about enrollment, when you need to do this. Again, 65 if you're not covered by a company plan, or you can wait until you separate from service if you are, as long as that company plan has at least 20 employees. I would encourage you to keep some documentation from that insurance provider showing your coverage, because when you do go to exercise your special election or your special enrollment period, you are going to have to prove to Medicare that you've had credible coverage since you turned 65 to avoid that 10% penalty. So just plan ahead, make sure you save that documentation showing you've had that credible coverage. Now, last resource I want to share with all of you is if you're going through Medicare.gov and you're going through all the mail in your mailbox and you're trying to make sense of what you should do and you still have questions, you're like, I'm not really understanding the difference between this Plan G and the Plan N, or help me with this Medicare Advantage and the restrictions, and I've heard that this company's good or not good. Where can I find and talk to someone about these questions? Well, now you're going to want to visit the second website I'm going to share with you, which is shiphelp.org. SHIP as in Paul, HELP.org. And your first thing you're going to do, you can either click on this button called Find Local Medicare Help, or you can click on the Ship Locator button. They both take you to the exact same place, which is this lovely screen where you're going to pick the state that you're going to retire in. So we're going to pick California. And so for the state of California, you get an 800 number and you get a website. This 800 number is staffed by volunteers who have been trained by the state of California and the Medicare people there to be able to answer your questions about Medicare in the state of California. A lot of people don't realize that this is a resource that's available. Every state in the union has one of these resources, and they have a website that's pretty awesome. So it goes through all the various resources that the state of California makes available to people who are either on Medicare or making decisions about Medicare. So again, if you want to find services in your area, click here, and it's going to take you through how you can get in contact with people in person or over the phone to get assistance in answering your questions and making your decision. It's kind of a shame that these resources aren't more well-known and promoted, but that's why I'm doing it right here on this call, because they're awesome and everybody should know about them. So, look, we've covered a lot here. My goal wasn't to make anybody an expert on Medicare or to essentially solve all your problems, but I did want to give you a map to your homework assignment, and hopefully give you some resources that can assist you in being successful in that homework assignment. And so with that, Don, why don't I turn it back over to you to facilitate any other questions that may have come in that we need to address, or anything else you want me to make sure we talk about?
Well, the only last question in the chat, and I think I can answer this one myself, is no, the 40 quarters don't have a shelf life. If you've worked 40 quarters and paid into the system at any point in your working life, even if it was decades ago, that you're squared away. And the final thing I will say is thank you very much, Rob, and to you, Michael, both for your expertise and for your efficiency. I know, even though I consider myself reasonably sophisticated on a lot of these topics, this was one that was mind-numbing when I tried to sort it out myself. So this is the closest I've come to actually understanding the right sequence to tackle this in. So to you both, hats off. Appreciate you. And any of you who have additional questions, many of these are individual, as we've discussed. So just ping us. We will try to help you get to the bottom of it. And I was grateful for some of the new resources that I didn't know about either, because now we'll be have a good place to send everybody. So cheers, everyone. And until next time, Michael and Rob, thank you so much. We'll talk to you all soon.
Thank you. Bye-bye now.
Bye.
Very good.